Advancements in heart scan technology have significantly enhanced the precision, efficiency, and safety of cardiac diagnostics. Mark Reynolds had always considered himself healthy. At age 59, he jogged every morning, ate his greens, and kept stress at bay. At least that's what he told himself. When his doctor suggested a routine heart scan during his annual checkup, he almost declined. Just a precaution, the doctor had said. It never hurts to check. So here he was, lying on a cold examination table, watching the technician glide a scanner over his chest. The room hummed with quiet beeps, the rhythmic whoosh of his own heartbeat filling the air. It was oddly hypnotic, until the technician's expression changed. A slight furrow of her brow, a pause too long. Mark swallowed. "Everything okay?" The technician forced a smile. "The doctor will go over the results with you." That was when the unease crept in. Minutes later, Dr. Patel walked in, holding the scan results with an air of practiced calm. "Mark, we found something unexpected," she said gently. "A small anomaly in your heart. It's likely been there for years." A weight settled on his chest. What kind of anomaly? A congenital defect. Nothing immediately life-threatening, but if left unchecked, it could cause problems down the road. She hesitated. If we hadn't caught it now, it might have been too late later. Mark sat in silence, absorbing the words. He had lived over 5 decades unaware of this silent flaw, this ticking clock inside him. Suddenly, memories flashed through his mind. Times he had brushed off fatigue, ignored the tightness in his chest after long hikes. He had convinced himself he was invincible. For the first time, he felt fragile, human. But then, something shifted. If life had given him this warning, wasn't it also a second chance? A chance to slow down, to cherish moments rather than race through them. He thought about his teenage daughter, the unfinished book he always meant to write, the sunsets he rushed past on his evening commutes. Mark exhaled, a breath deeper than he had taken in years. "I guess I got lucky," he murmured. Dr. Patel smiled. "Yes, and now you get to do something about it." As Mark stepped out of the clinic, the world felt different. The air was crisper, the sky a deeper shade of blue. His heart was flawed, but it was beating. And for the first time in a long time, he was truly listening to it. Advancements in heart scan technology have significantly enhanced the precision, efficiency, and safety of cardiac diagnostics. Here are some notable developments. 1. AI and machine learning have revolutionized cardiac imaging by improving image quality, reducing processing times, and enhancing diagnostic accuracy. These technologies assist in detecting subtle cardiac abnormalities that traditional methods might overlook, thereby aiding in early intervention and better patient outcomes. Second, fast strain. Encoded cardiac MRI is an innovative MRI technique that captures cardiac contractility in a single heartbeat. This advancement is particularly beneficial for patients with arrhythmias or limited breath-holding capacity, as it reduces the need for prolonged imaging sessions. 3. Photon counting, computed tomography, PCCT, represents a significant leap in imaging technology. For instance, the Siemens Alpha system provides medical imaging with up to 45% less radiation and up to 4 times the accuracy of existing CT machines. This technology is particularly advantageous for heart and lung patients, enabling earlier diagnoses and more tailored treatment plans. 4. Advanced imaging agents. The approval of new diagnostic drugs such as GE Healthcare's Flyrcado has enhanced the capabilities of PET myocardial perfusion imaging, PMPI. Flyrcado uses radioactive tracers to create 3D images of blood flow to the heart, offering higher quality imaging and improved defect resolution, especially in challenging cases like patients with a high body mass index. 5. Hierarchical phase contrast tomography, HIPCT. Researchers have developed HIPCT, a novel X-ray technique that captures images of the human heart with unprecedented detail, allowing visualization down to the cellular level. This advancement holds promise for enhancing our understanding of cardiac structures and improving diagnostic accuracy. These innovations collectively contribute to more accurate diagnostics, personalized treatment plans, and improved patient outcomes in the field of cardiology. Take care of your heart, eat right, exercise, get regular checkups, and stay healthy. Here's to living your best life at any age. You've got the wisdom, the strength, and the heart to make these changes, and I believe in you. Keep shining, keep thriving, and remember, Your health is worth every small step you take. Until next time, take care and be kind to yourself. Thanks for watching. Please like and subscribe for more informative videos.